Good morning, Facebook world. My name is Kara Canuck, and I am one of the co-owners of Des Moines Mom. And today I have the pleasure of speaking with Brad Hill. He is a certified physician assistant, and he is with UnityPoint Clinic Express in Ankeny. So good morning, Brad.
Good morning. How are you?
Good. Um, Tell me a little bit about where you are located in Ankeny.
So I'm at the new Ankeny Express Clinic. It is located at 1055 Southwest Orlabor Drive, just on the south side of the DMAC entrance there.
Okay.
And so it just opened up May 22nd.
Okay, very good. And express care is a little bit different than, what the urgent care model is. And I know there are 3 locations in the metro. What are those 3 UnityPoint Clinic Express Care locations?
So the first Express Care opened up by Jordan Creek Mall, and that's at 180 Jordan Creek Parkway in West Des Moines. It's kind of on the west side of the mall there, next to Jimmy John's. And so the other one would be, the second one was in Waukee, and that's on 950 East Hickman, just on the south side of Hickman across from Hy-Vee out there.
All right, very good. Can you, for our viewers who are not familiar with what Express Care is, can you tell me a little bit about that?
So Express Care is kind of a newer style of urgent care, newer experience, I would say. And so our goal is to get you in and out in 30-minute average throughout the day. And so it's more for, the simple cough, cold, upper respiratory viruses, ear checks, acute injuries and illnesses.
Okay. When you say acute injuries and illnesses, what does that encompass?
So acute injury or injury would be, skateboarding and fall and hurt your wrist. And so you need x-rays to see if it's broken. And so we do have on-site x-ray where we can take those images and know right then and there if it is broke. And we also have splinting capabilities to stabilize any possible fracture. Illnesses, again, would be ears, ear infections, fevers, rashes, UTIs, a lot of the common simple stuff that can come about pretty quickly. So.
Okay. So how does Express Care differ from urgent care?
I think the biggest thing with Express Care is the experience. Again, more for the really acute illnesses and injuries. The one thing that we do not have is in-house blood draws. So more abdominal pain, chest pain, chronic illnesses. Really, we can't do much with, just because we can't get that instant knowledge of if somebody's fighting an infection off, a more severe infection, or if we can't get the labs needed to see if somebody's actually having a heart attack or not. So it's just, we're kind of handcuffed as far as being able to look into that a little further for people.
Okay. And so I know, I feel like I was told at one point, Express Care, the model, like the waiting room model, is a little bit different too.
Yeah, so it's pretty cool. It's a kind of open air type of model. You walk in, you'll see the staff sitting right at the front desk. We have coffee, crackers, cookies for the kids and people waiting, and waters, and TV's going, we have music going, and you can see the provider sitting there, right, or standing there working right when you walk in, because it's just basically a giant open room. All the rooms are on the right side of the office, and so you can see it's a good team model. We can talk easily, and it's just kind of you don't feel like the patient, when they walk in, doesn't feel like they get stuck in a waiting room and we don't know they're there. So
is that part of how you kind of are able to keep your visit to 30 minutes then?
That helps. Yeah, that helps. But also, right when you walk in, it's different, because if there's rooms available, we take you straight back to the room and we actually check you in the room. We're not doing insurances and signing waivers at the front desk, and you sit down and you get back and up and take it to the room. So if the rooms are available, yes, we are able to take you straight back and just get things going a lot faster. But there's a lot of people been getting sick recently, so it's been a little bit slower than we liked, but we still are striving very, very hard to get you in and out in an average of 30 minutes.
Okay, That sounds good. I also feel like somebody had mentioned at one point too that, right, like along with insurance, like the checkout portion too is nice because it takes place there in the patient's room and not like
Yep.
out in the lobby.
Yes. Yes. So everything is done in the room.
Okay. That I think, especially in this time, where we're still seeing lots of, disease or, sickness that people are concerned, might be COVID or, are concerned about potentially catching COVID. I think that model is really reassuring for
Yeah.
some of those people too, to make
Yeah.
sure
Yeah.
that not sitting out in, a petri dish of a waiting room type
That's
of thing.
right. That's right.
Okay, so let's break it down because we have, your walk-in care, which would be your urgent care or express
Huh?
care,
Yep.
versus, going to the emergency room versus, waiting and seeing your primary care physician. When is the right time to kind of to go to these different places? How do you know what is, something that requires an emergency room visit versus maybe something that goes to like urgent care?
Right. So the big things would be that chest pain, the abdominal pain. You got to think anything that could possibly be life threatening.
Mhm.
Better off probably going to the emergency room, especially chest pain. I mean,
Yeah.
it's just it's you really need that kind of in-depth blood work, more. If IVs are needed, that's all stuff that can be done in the ER. No, none of the UnityPoint urgent cares do IVs. So, if you feel like you're dehydrated, uh, again, any severe abdominal pain that could get worse and cause prolonged issues or even death, better off in the ER. That being said, uh, pros of the standard urgent care is that they can do blood work. They can do some of that blood work to evaluate for chest pain, but
Mhm.
still, if those markers are elevated, we have to send you to the ER to be seen. So,
Mhm.
but for express care, again, it's more the acute illnesses and injuries, the simple stuff.
Mhm.
Lacerations, we see a lot of lacerations as well. We can handle those.
Yes. Yep. I can definitely think of the situations in my own family's past history where it's like, okay, so do we need to go to the emergency room for stitches? Do we
Yeah.
need to go to urgent care? What is our best
Yeah,
scenario?
stitches any urgent care can take care of for sure, unless it's just like a massive chainsaw injury or something, which has come to express
Oh
care
my
before. But
goodness.
yeah, we can take care of it.
Okay, let's talk a little bit about, urgent care versus waiting, for your primary care physician and getting an appointment with them. Are there like is there a general rule of thumb as far as knowing when to wait versus when to go in?
I think more the chronic illnesses, the chronic illnesses that could possibly getting worse. So diabetes, uh, blood pressure, asthma exacerbations or worsening asthma, certainly that's an urgent care. We can do breathing treatments and help with that. But just
Mhm.
the chronic illnesses out there that people know they have, and that if they feel like things are changing for them, whether it's their meds need to be adjusted, that would be way better off with their primary care doctor.
Okay. Yeah, no, that makes sense. One of the things that we haven't talked about with the Unity Point Clinic Express is your hours
Yeah.
and when you're open. Can you tell me a little bit about what makes you special for that?
Sure, yeah. So we're open 8 to 8, 365 days out of the year. We are on the holidays. There's only 3 express cares, so we are the only ones open on those days to see people. And so obviously they're busy days, but we're
Mhm.
glad to be there to help people out and get them in and out as fast and efficient as possible.
Right. Because you know what? Accidents and sicknesses and all of those other things, they do not care if it is Christmas or a holiday when
They do
everybody else
not.
has the
They
day
come
off.
when you least need it to and you least expect it.
Absolutely. No, I totally get that. And it always seems like kids get sick on, Friday evening, over the weekend where, your regular doctor is not available. And
Yep. Friday and before you're going on vacation.
true. It is absolutely true.
Yeah.
Always those times when you least need them. One other thing I wanted to touch on. Um, like prescription and ability to get, meds and stuff
Yeah.
at your locations. Is that something what types of services do you have for that?
Yes, sorry, I did not mention that, but we do have on-site pharmacies. So those instances where, if you're traveling through town or you don't have time to run to the pharmacy, if you have a bunch of kids and just can't go into a store to pick up medicines, we do have on-site pharmacy for the common medicines, the common antibiotics, medicines used to treat UTIs, all that simple stuff that you would be prescribed, like amoxicillin, just any of the simple common medicines that you have for your acute illnesses. We do carry those. So
Yes, no, that saves the trips. I think that is super important when you're trying to consolidate and not spend half a morning trying to, see a physician and have them tell you what's wrong with you, and then as
yeah,
well as trying to get something to help you with that. So
yeah,
no,
yeah,
those are awesome. Okay, well, I think we have covered, the high points of what express care looks like, and the three openings that you have, or the three locations that you guys have here in Des Moines. So thank you so much for your time today,
yeah.
Brad,
You're welcome.
and we look forward to seeing you, but also not seeing you.
That's right. I'm there if you need me.
Awesome. Thank you.
You're welcome.